we are going to have the right sacro anterior as a way of or position that we're going to use for this particular session. So you have your pelvis there, and then you have this coming in through the right sacroanterior. And if it is coming through the right sacroanterior, then it has made all those movements. The mechanism of a breech presentation or a breech birth, I have done a separate video on that, so you can definitely look at that as well. So when you find that it comes around on this end, meaning that it has distended the perineum here, and then the legs do not deliver on their own, then it means that the legs could be extended legs, and then you have to employ your maneuver to go ahead and then deliver the legs. So before you even go ahead to do that, because those will be more or less internal maneuvers, you may evaluate on whether you need to actually perform an episiotomy there so that you broaden the way, or you may not need an episiotomy. If you don't need an episiotomy, then well and good, go ahead and deliver those legs. But if you need it, you're better off having it. Okay, so once that then has happened, what you're going to do is you will follow the legs. That is, we're starting with the anterior. So you follow the legs here, and as you're following, you're going all the way to the popliteal fossa, right behind the knee there. And as you do that, you'll be applying digital pressure onto the popliteal fossa. Applying digital pressure onto the popliteal fossa is then going to help flex that leg. So meaning that you have to use your other finger now to actually grab that fetal limb like that, and then that is going to then facilitate the delivery of that leg. So you have applied digital pressure into the popliteal fossa, that then flexes that, and then you go ahead and deliver that one. So you would do the same as well. Let me just keep this one off the way. So you would do the same as well. Follow that leg down into the popliteal fossa here. Apply digital pressure on that end. That is going to force that little guy there to then flex. Then you use your other finger now to grasp that leg and then go ahead and deliver, and then it means that the legs would have been delivered. Now that maneuver is a maneuver that we call the PINARDS maneuver. It is a maneuver that is used to deliver extended legs.